In the MonarchE study, we just saw that adjuvant abemaciclib can really improve outcomes in patients with high-risk hormone receptor-positive breast cancer, which is a common population and with a high unmet need. However, what we don't know is how common this population is in clinical practice and if it has particular feature which makes it different from other populations, let's say, with lower risk. And what we did was comparing a population based on the MonarchE criteria to a population not meeting those criteria. And what we found is that 11% of the patients in general, in a cohort of more than 5,000 patients, 11% were eligible for adjuvant abemaciclib. And the characteristic of this population is that they were enriching young patients with BRCA2 mutations. And this has interesting implications because it means these patients might also receive Olaparib as adjuvant treatment. And we also found that there were more patients with a high-risk Oncotype DX score. Nonetheless, most of the patients, 70%, had either intermediate or low risk. So many of these patients will not receive adjuvant chemotherapy. And in the future, I think there's going to be big changes in the way we treat these patients. Many patients might not receive chemotherapy, but do receive adjuvant abemaciclib and maybe also Olaparib.